Okay, so good morning everyone. What we'll be having right now is a discussion po on your fundamentals of nursing care. And for the NCLEX of our topic po for today, we'll be having the reduction of risk potentials. On the other hand, kapag dating naman po sa PNLE, ang tawag po natin dito is safe and quality nursing care. So kasama po ito sa test plan ng NCLEX, while sa ating pong Philippine Nurse Licensure Examination. Kasama po ito sa gusto actually na lumabas ng mga Board of Nursing, members of the Board of Nursing. And essential po ito na malaman natin, no, because this will be crossing out actually all throughout your all NPs pagdating po sa ating pong Philippine Nurse Licensure Examination. Okay? So, okay. What will be our topics here? What we'll be talking about is about your vital signs primarily. Okay, about your diagnostic tests, your basic diagnostic tests, changes in condition, complications mga kapatid, and also with your focus assessment, and complications of perioperative nursing. Okay, so again, this will be our topics, and you know what, it's very essential na dapat alam natin kung ano mga basics, because one of the failure of our students is that because they really strive more on understanding the complex things when it comes to the nursing concepts, they oftenly forget kung ano yung mga basic things that they should know. Okay? So, that's our goal here. To go back to what is basic, to go back to what is essential, because majority and mostly of our students fail because they don't know the basics of things. Okay? So, let's start just what we call fundamentals of nursing. Okay, let's start talking about your vital signs, kapatid. Okay, so ang mahalagang bagay lang that we should know about your vital signs is what are those vital signs? Okay, and kapag sinabi nating vital signs, the most important thing to know here is what is normal and what is abnormal. Okay? What is normal and what is abnormal. Bakit? Kasi kapag alam natin, kapatid, if what is normal and what is abnormal, basically, we know when to respond to, okay, what will be our nursing action, what is the appropriate nursing plan that we should be doing, we should be plotting, because kapag in the first place, hindi natin to alam, basically, wala tayong next steps. Okay? Malaman lang that in your Philippine Nurse Licensure Examination, the question always of the board examination is that it would go this way. What is your next action? What is the best nursing action? What is the initial nursing action? So you should know your vital signs, okay? So for your vital signs, big word in the board examination is that we should know our temperature. Okay, temperature, kapag sinabi nating temperature, kapatid, okay, all of us will agree that the normal for this is 36.5 degrees Celsius to 37.5 degrees Celsius. In the United States, kapatid, pag 37.5, pagdating po sa ating pong temperature, mostly, it's given in Fahrenheit. However, the difference between your Philippine Nurse Licensure Examination at NCLEX is that sa NCLEX po, ang ating pong normal range ng vital signs and even actually pagdating po sa laboratories ay given po. Okay? So that's why it's quite different pagdating po sa PNLE because it's not given. And aside from that, what's being used in the United States is degree Fahrenheit. Okay? So, pagdating naman po sa ating pong BP, okay, we know that our normal BP is actually 90, okay, over 60 millimeters mercury. Okay? Kasi, we say, 90 over 60, diba? That's very low. Actually, it depends because that's why our nursing concepts agrees, no, that there should be a range also of your blood pressure. Bakit? Kasi may mga tao naman na 90 over 60 sila pero it's just normal to them. So what I'm trying to say is that it depends. Okay? So the normal here is that 90 over 60 to 120 over 80. Okay? So kapag tumaas, we call that hypertension. Kapag bumaba naman, we call that as your hypotension. Okay? So next is your respiratory rate or RR respirations. So, ang normal natin dito, we only need to agree that it's 12 to 18 breaths per minute. Okay? or cycles per minute. We call it as your CPM or BPM. That's it. Okay? So, another thing, class, is your pulse. Pagdating sa pulse, we sometimes call it as your heart rate. Yan. So, this one is big time in the board exam. It's 120. Kapag bumaba to, kapatid, we call it as your bradycardia. Kapag tumaas naman, we call that as your tachycardia or tachycardia. Okay? So, now, I want you to know that there is a big word in the Philippine Nurse Licensure Examination, PMI. PMI means as the point of maximal impulse. Okay? So, PMI is located in your fifth intracranial space, mid-clavicular line. Okay? Fifth intracranial space, okay, mid-clavicular line. So, what I'm trying to say is that ang PMI po na ito, this is where your point of maximal impulse takes place. So, it's a part of your chest, okay, nasa fifth intercostal space, mid-clavicular line, wherein nandyan po, kapatid, ang pinakamalakas no, na pressure. Okay? So, it's actually in your left ventricular pressure. Okay? It's where the pumping is loudest and strongest. So, we call it point of maximal impulse. So, apical pulse po ang tawag natin dyan sa site na yan. Okay? So, mamaya we'll be discussing further more on that. Okay, another thing, kapatid, because we have this fifth vital sign, we call it as your pain. Okay? So, pain, what I have to say is that it is highly subjective. Okay? We all need to agree na kapag sinabi po ng pasyente na he or she is in pain, and then we must believe the patient that he or she is in pain. Okay? So, that's it, kapatid, for this one. Okay, so now let's discuss your temperature. Kapag sinabi nating temperature, kapatid, it is just this is the heat, okay? This is the level of heat that's actually being or the status of the heat ng ating pong buong katawan. Okay, so that's what we call as your temperature, because as our body performs its functions, it creates your heat energy. Okay, so what we need to do on big time for the Philippine Nurse Licensure Examination and even in the NCLEX are your temperature methods. Okay, your temperature methods. Okay, temperature methods, kapatid, kapag sinabi nating temperature methods, we have your rectal. Number 1, big time rectal. Okay, kapatid. Number 2, okay, axillary. Okay, axillary also. Number 3, temporal. Okay, temporal. And number 4, kapatid, we have your oral. And last but not the least, of course, we have your tympanic. Okay, we have your tympanic. Kapatid, the question here is that big time and always being asked in the board exam, what's the best method or what's the best route of temperature taking? So kapag tinanong kayo niyan, class, big time also, it's actually the rectal, okay, route. So it's best for core temperature. And kapatid, isa rin sa mga nais kong malaman ninyo is that kapag dating po sa ating mga newborns, we actually use the rectal route for one big reason. Una, that is to get the accurate temperature po ng baby po natin. And another, class, that is to assess this certain situation, no, or certain condition. This is for your newborn. Okay? Sa puwet po natin kinukuha, in the rectal po natin kinukuha, rectal route ang temperature. Firstly, to get the best or the most accurate, kapatid. Aside from that, to assess for this what we call as your anal atresia. Anal atresia. Kapatid, kapag sinabi natin anal atresia, okay? When we say anal atresia, that this is a condition na kung saan there is an absence actually of the anal opening. Okay? So, no anal opening, and this has to be reported, class, to the obstetrician. Okay? Obstetrician, gynecologist, and even to the pedia. Okay? So, ayan. So, we need to think about this one. Okay. So, again, best route for your temperature, we have your rectal, kapatid. And also, kapatid, kapag tinawag, what is our condition kapag ang ating pong temperature is too high? Now, we suspect big thing here. Okay, we call that actually generally as fever, which is an indication of your infection. Okay, and of course, no, so hyperthermia is actually different from your fever in the sense that fever is actually caused by your infection. Okay, but when we say hyperthermia, that is an elevated generic, okay? Generic po siya na generic siya na term that when we say that when there is an elevated or extremely elevated temperature, we do not necessarily say na fever yan because fever is specific po to infection. While your hyperthermia, this could be caused by your exposure, kapatid. Exposure, or kung walang exposure class, this could also be caused by your some medications, okay, that can cause class elevated body temp. Okay, so that's the difference between the two. While kapatid, kapag sinabi nating ang temperature natin ay too low, okay, we call that as your hypothermia. Hypothermia. Okay, hypothermia po naman ang tawag natin dyan. At ito po, this is caused by your exposure naman, okay, to extremely what? Extremely low or cold, okay, elements. Yan, okay. So that's the difference between the two. So this is enough now for us pagdating po sa ating temperature. Okay, so now let's talk about your blood pressure. Kapag sinabi nating blood pressure, again, the normal here is 60/90 millimeters mercury to 120/80 millimeters mercury. Okay, so the big thing in the board examination, you need to know about your normal range so that we would be able to say kung saan na nagkakaroon ng hypotension si pasyente, to look at also for signs and symptoms of your shock para alam din ng ating pong nurse. Okay, so big thing here, what's the most important to take note here is the client's positioning. Okay, positioning of the client. So the feet must be on the floor. Tandaan po natin, on the floor. Okay, and another big thing is that legs must not be crossed. Okay, the legs must not be crossed because it can give us an alteration in the results. Okay, so when it comes to sizing, kapatid, or when it comes to certain alterations, we just need to consider kapag sinabi natin, kapatid, na BP taking, tandaan po natin if the cuff is too small, okay, too small, okay, this will give us your falsely elevated reading. Okay, elevated reading. Okay, and also class, kapag sinabi naman natin na, kapatid, na cuff is too big, okay, this will give us also a falsely, okay, sulat natin, lowered, okay, reading. Okay, ayan. So, ayan, kapag mababa po ang ating pong BP, we call that as your, if the BP is low, we call that as your hypotension. Okay, hypotension. If it is high naman, on the other hand, we call it as your hypertension. Okay, big hit there. Now, as I have to add this one, kapatid, when taking your BP, another thing to consider is that the sphygmomanometer, okay, yung sphygmo po natin, the monitor of the sphygmo actually must be at the eye level of the nurse. Okay, so yan, this is according to Kusher-Berman and Snyder's book. Kapatid, kapag kasi hindi parallel, okay, kapag hindi parallel yung mata, halimbawa if it is way higher, okay, may nagkakaroon tayo ng alteration. Okay, if it is naman way also lower, okay, that's another also alteration. So according to Kusher-Berman and Snyder, it must be at the eye level. Why? Because kapag ginawa natin na hindi naka-eye level, there would be this what we call as your error of parallax. Okay? This, we have yet what we call as your error of parallax. And that's something, kapatid, na we don't want to happen because it's an alteration. Generally, no, it's an alteration of your blood pressure taking. Okay? So, remember that one. Okay. Next, kapatid, pag-usapan natin ang ating respiratory rate or respirations. Okay, so normal po natin dito, pagdating sa ating respirations is 12 to 18, okay, CPM or BPM, breaths per minute. So, Usually class, big time and big hit in the board examination. Tandaan po natin kapag low class, there are some instances na bumababa po ito. Okay, bumababa lower than 12. Halimbawa, 10, 8 cycles per minute. It's because of some exposure to substances, medication overdose, and big hit in the board exam class where one of the most common is your opioid toxicity. Okay? Opioid toxicity. Again, class, kapag may opioid toxicity, alam natin, we give your antidote. We give your antidote, kapatid. Ang antidote natin dyan is your naloxone. Yan, naloxone, Narcan. Okay? So, big thing in the board examination. So, now, kapatid, pagdating naman kapag ano naman yung mga conditions na will make our respiratory rate high. So, it's a bit faster. Okay? So, this is caused by your conditions such as, say, for example, your anxiety. Okay? So, big thing in the board examination, anxiety, breathing is faster. Okay. So, now, consideration here, wag po natin iso-shortcut. We should count for what? For 1 full minute. Tandaan po natin yan. We should count this one for 1 full minute. And, okay, anong consideration natin pagdating po sa ating pong mga infant? Pagdating po sa ating pong infants, kapatid, our consideration is that we must look at, saan po tayo titingin? We must look at their abdomen. Why? Okay? Because they are actually mouth breathers at this time. So, to count for respirations, ang dominant po nila na physical assessment would be the rise and fall of their abdomen. Okay? So, that's it. So, kapag mababa po ang ating pong RR, we call that as your bradypnea. We know that. We just need to be reviewed about this one. Okay? So, kapag mababa po ang ating respiratory rate, what would happen to us? Okay? Tandaan ninyo, what we are actually excreting via respiratory system, what gas are we excreting through the respiratory system? It's what we call as your carbon dioxide. So, kapatid, dahil too low ka dito, yan, anong nangyayari sa'yo? Kapag mabagal ang respiration mo, so mabagal din ang paglabas class ng inyong waste. So, remember that your carbon dioxide is an acid. Okay? Okay, again, remember that your carbon dioxide is an acid. So, what would happen to you, kapatid, kapag you are not excreting more and more carbon dioxide? So, dadami sila sa inyong lungs. What would happen to us is magkakaroon tayo ng tinatawag natin respiratory acidosis. Tandaan po natin to. Okay, respiratory acidosis. Okay, while kapag mataas naman class ang ating RR, okay, mataas ang ating pong respiratory rate. So, anong mangyayari sa iyo, kapatid? Ang tawag natin dyan is your tachypnea. Okay? Tachypnea. Okay? Tachypnea now, it can cause, upon the other hand, your respiratory alkalosis. Because what happens here, kapatid, we sometimes call this as your hyperventilation. So, lumalabas ang mas marami pong lumalabas na carbon dioxide. So, we are losing more and more acid. So, what happens now is nagkakaroon po tayo ng respiratory alkalosis. Okay? So, take note of that. Okay. Now, another concept here, kapatid. Okay, so, now we see here your pulse. Okay, kapag sinabi nating pulse, kapatid, ito po yung heart rate natin or pulso. And, kapatid, what is very important here also, kapag sinabi nating pulse, you need to memorize your normal rate. Okay, and our normal rate for this one is actually 60 to 100 beats per minute. And you must count this one for 1 full minute, not 15 minutes and then multiplied by 4. Okay, not 1 second and then multiplied by 60. Okay, that's actually unethical, kapatid. So, 1 full minute po ang pag-count natin dito. Okay, so special considerations natin for your newborn, of course, you need to remember to always to be religious. about your taking of 1 full minute, and aside from that, you take the apical pulse. You take the apical pulse of the newborn. Okay? Why? Because there is an irregularity, kapatid. Okay? Irregular rate, kapatid, between your in your other how we call this, in your peripheral pulses. So kapatid, the most accurate, okay, site for us to assess pagdating po sa ating mga newborns is your apical pulse. Okay? Sa atin naman pong mga adults, kapatid, we get this one, okay, through your radial pulses. Okay? Radial pulses. So now, what we need to think about this one, big hit at the board examination, palagi itong tinatanong niya. Even in the NCLEX, okay, let's talk about the pulse amplitude. Okay, kapag sinabi nating pulse amplitude, kapatid, is just actually a numerical scale kung gaano nga ba kalakas, kapatid, ang pagpintig po ng ating pulso. So, we have a scoring of 0, 1, 2, okay, 3. So, these are actually positive numbers. Okay. So, kapag 0 po, kapatid, ang ating pong pulso, in the pulse amplitude, we know that it's weak or absent. Okay? Or absent. Okay? So, kapag sinabi naman natin pong 1, that's thready, or para siyang weak talaga, weak and thready, or diminished. Okay? Those are the big thing there. Okay? And kapag 2 po, that's normal. And kapag sinabi naman pong 3, that's actually bounding or strong. Okay? Too strong. Okay? Bounding. Big word there. It's bounding. Okay? So, ulit, kapag mataas po ang ating pong heart rate, that's what we call as your tachycardia or tachycardia. Sige? Very good na indication po nito is actually, big word in the board examination is your impending shock or early stage of your shock. Okay? Na kung saan class nagko-compensatory mechanism po ang ating pong heart. So it's trying to pump the blood that's available in the body para po masupply ng mga vital organs sa buong katawan natin. Okay. So kapag mababa naman po ang heart rate, okay, we call that as your bradycardia. Okay, so tandaan po natin yan. Bradycardia. For bradycardia, I would just like to give a highlight on this one. So for your bradycardia, kapatid, there is this problem. We have this cranial nerve number 10. We call that as your vagus nerve. And isa sa mga mnemonic ko po sa mga estudyante ko is that always remember your vagal, pampabagal ng puso, because kapag na-trigger po or na-stimulate po ang atong vagus nerve, all the more po na magkakaroon tayo ng bradycardia. Okay? So, kapag may bradycardia po si pasyente or kung may heart failure na kung saan nagbe-bradycardic po si pasyente, so never, ever stimulate your vagus nerve. Such as, say, for example, your rectal or anal stimulation. So, okay? So, you avoid anal stimulation. So, alam mo na yan. You avoid your suppositories or rectal suppositories. So, you give your patient increased fluid intake so that maging soft po ang stool ng pasyente po natin. Okay? So, that's it. Okay, next topic, kapatid. Let's talk about your pain tuloy. Your pain, kapatid. Kapag sinabi natin pain, kapatid, this is actually the fifth vital signs. Tandaan po natin. The fifth vital sign. Okay? So, this is actually a new concept. Dati, it's not considered actually as a vital signs. Okay, way before. Sa mga panahon pa ng yan. Okay, so, kapatid, kapag sinabi nating pain, this is the fifth vital sign and it's highly subjective. Tandaan po natin. Okay, highly subjective. Anong ibig sabihin ko dito? So, kapag sinabi po natin highly subjective, if the patient says he or she is in pain, we need to assume that he or she is in pain. And that's really true. Okay? So we don't question, we don't quarrel with the patient. But there is actually ways for us paano siya nagiging objective. It becomes an objective cues, kapatid, kapag gumagamit na po tayo ng ating pong mga tools. So, ang mga ginagamit po nating mga tools dito, we have your scales. Okay? Ang mga scale tools or tools po natin na ginagamit to measure pain. So, we have your number one, the most famous, the numerical pain rating scale. Okay? Wherein you just ask the patient to rate the pain, 10 being the highest and 0 being the lowest, and that's it. We also have, kapatid, your number 2, we have your Wong-Baker. Okay? You have your Wong-Baker. Isulat natin yan. You have your Wong-Baker. And pangatlo, kapatid, we have your Kreis Pain Scale. Okay? Kreis Pain Scale. Okay? Kreis Pain Scale. And also, kapatid, we have your FLAC. Number 4, we have your FLAC. Okay? Pain Scale. Okay? Yan. Pain Scale. So, we also have your non-verbal pain scale. Yan. So, big thing in the board examination, lalo-lalo na pagdating sa NCLEX. Sa NCLEX naman to, I have to highlight this one, kapatid. Pagdating sa NCLEX, kapatid, we have this what we call as your patient-controlled analgesia. So, it's what we call as your patient-controlled analgesia. Yan. So, kapag sinabi nating patient-controlled analgesia, kapatid, this is actually a type of device na which is via pump, wherein it's the patient really that controls the device. Okay, kung ano yung pain level kung ano yung pain level niya, that's the analgesia that he or she needs. So, it's a patient-controlled analgesia. Okay, big word here. Patient, okay, should only be or should be the only, okay, the only, tandaan po natin yan, to push, okay, to push the PCA, okay, not the nurse, not the relatives, not the doctor, the patient. That's why we call it in the first place patient-controlled analgesia. Okay, so that's it. Okay. So, that's enough for pain, kapatid. So, let's discuss your invasive monitoring. Okay, so we have here your intracranial pressure and pulmonary artery pressure. So, kapag sinabi natin, kapatid, na intracranial pressure is the pressure inside the skull, while your pulmonary artery pressure is the pressure in your pulmonary artery in your respiratory system. Okay, so kapag sinabi natin intracranial pressure, the normal, kapatid, normal na intracranial pressure is 5 to 15. Upon the other hand, kapag sinabi natin, kapatid, na pulmonary artery, normal for this one is 80 to 20. Okay, so how do we measure your intracranial pressure? Okay, how do we measure this one? Okay, how do we measure this one? We measure this through your implantable. Sulat po natin yan. Implantable. Yan, implantable transducers. Okay, transducers. Okay, in transducers or your probes. Okay, or your probes. While your pulmonary artery, kapatid, this is measured. Okay, this is measured through what? Through your Doppler echo. Yan. Okay, through a Doppler. Yan, through a Doppler echo. So, tandaan po natin yan. So, kapag too high po ang ating pong intracranial pressure, kapag too high, what does this indicate? Okay, we need to implement yan. Implement what? Implement measures to what? Measures to decrease the ICP. Okay, and start what do you want to start? Big word for your ICP, seizure precautions. So, tandaan po natin yan, kapatid. Okay? Seizure precautions. Okay? Seizure precautions. So, big word there, kapatid. Okay. While on your pulmonary artery pressure, kapatid, if this is too high, okay, too high, we need to know that this is what we call as your pulmonary, okay, artery, pulmonary artery hypertension. So, we sometimes call this one as your pulmonary hypertension, or specifically we call this one as your pulmonary artery hypertension. Okay? So if this happens, okay, what would this mean? So because it affects, kapatid, it affects your what? It affects right side of the what? Right side of the heart, okay? The heart and the arteries, okay? And the arteries, okay? Going to the lungs. Okay? So alam mo na ngayon, kapatid. So kapag mangyari to, you need to think that it will affect your right side of the heart and arteries going to the lungs. So you would have problems, kapatid, within your pulmonary circulation. So the problem will be mostly, kapatid, dito po sa ating pong respiratory problems. Okay? So that's it. Again, normal for your intracranial pressure, 5 to 15. Normal for your artery pressure, we have 8 to 20. Okay, so now let's discuss your diagnostic tests and laboratory tests. Okay, so first, kapatid, big hit in the board examination, we have your MRI. Okay, so kapatid, kapag sinabi nating MRI, that's your magnetic resonance imaging. Okay? MRI is magnetic resonance imaging. So, tandaan po natin that your MRI is a non-invasive, we write this down, non-invasive imaging method. So, it's a non-invasive imaging method, and this uses, tandaan natin, okay, magnetic field. Okay? Magnetic field. Okay? This uses magnetic field and radio waves. Okay? And radio waves to determine what? To determine anatomy. Okay? Anatomy. So now, dahil alam na mo na it uses your magnetic fields and radio waves to determine anatomy, so you must know that there would be problem kapag ang pasyente po natin ay mayroong mga metallic sa kanyang katawan. So alam mo na to. Okay? So usually, gaano nga ba katagal, kapatid? Gaano katagal ang ating pong procedure dito? This actually lasts for 15 to 60 minutes. Tandaan po natin yan. This lasts for 15 to 16 minutes. Big word for the board examination. So, dito rin, kapatid, our patient class, our what would be our ano ba ang gusto natin mangyari dito? So, the MRI may actually show your soft tissue or organ changes. Okay, so tandaan po natin yan. So, it is best used for your brain, spinal cord, kapatid. Okay, spinal cord, also with your nerves. Okay, with your nerves. So, ganun yan, kapatid. It is best used for your spinal cord and nerves. And ang ating pong MRI, remember, it may use or may not use, okay, may not use your contrast. Okay, so that's a big thing there. So, pwede siyang gumamit ng contrast, pwede rin hindi. So, tandaan natin yan. So, what you need to think about now is, what are the considerations that we need to do? Okay, what are the considerations that we need to have? So first, let's discuss before MRI, what should be the nurse doing before MRI, or what should be the consideration of the nurse before MRI? Kapatid, you need to ensure that, okay, that client has no metal, okay, object sa ating pong pasyente. Okay? So, say for example, your watches, your jewelry, and another, kapatid, you need to assess the patient for what? For claustrophobia. Okay? For claustrophobia. Okay? Because the patient will be in an enclosed machine dito, so you need to assess for your claustrophobia. and also assess if the patient has, assess if the patient, okay, assess for what? Assess for pacemaker or may pacemaker. Okay? Kapag si pasyente po natin ay may pacemaker, you should assess for that. So, it's an implant, kapatid, na within your cardiac muscle. So, we need to assess for that one. Okay? So, why? It's because there are some MRI machine. Okay, MRI machines may deactivate them. Okay? Tandaan po natin 'yan. Okay? And this is for your pacemaker, ha. And some newer machines are safe. However, no, may mga machines din naman, okay, na safe. Some newer machines, okay, are safe. Okay, so now kapag ganito class ang mangyari, so what you need to do is to assess first, kasi baka din naman, kapatid, na hindi kaya po ng ating pong how do you call this, ng ating machine. Okay, so also, kapatid, tandaan po natin, okay, contraindications, big word in the board examination. Okay, we need to take a highlight on this one. Okay, so contraindicated ito para sa patients class na may mga agitation, and also, kapatid, sa may mga old tattoos. Okay, old tattoos. Sir, bakit naman pati yung may mga old tattoos? Why? Because they contain, okay, a substance we call as your lead. Okay, lead. Okay, so they contain lead, so we must be taking a very, very careful consideration with this one. Okay, so that's it for your MRI. Let's proceed to your CT scan. Kapatid, kapag sinabi natin CT scan, okay, this is your computed tomography scan or your CT scan. Okay, so kapatid, kapag sinabi natin CT scan, this uses many X-rays to form three-dimensional anatomical picture. So this is just actually using an X-ray pero 3D siya. Okay? Three-dimensional anatomical pictures. Okay? So tandaan po natin 'yan. It's like you're actually having an X-ray that's way 200 times, 100 times. So that's it. Okay? So we will be put or in a donut shape scanner. So gagamit po dito ng donut shape scanner. Okay, donut shape scanner. Okay, tandaan natin to. And also, kapatid, remember that you may or may not use also contrast. Pwedeng meron or may not use contrast. So remember this one. So our patient class may use or may not use contrast. However, class is this contrast is actually your contrast is more helpful. Okay, your contrast is helpful, kapatid, in determining tumor. Okay, this is best used for your tumor identification. Okay, tumor identification. Okay, now the client must remain still. So tandaan po natin, the client, ano dapat ang behavior ni client dito? Must remain still. Okay, he or she must remain still. And also, kapatid, tandaan po natin that each of the machines or scans, okay, each scanning, okay, each scanning class takes, kung kanina, kapatid, it takes us 15 to 60 minutes. Dito naman, class, mas mabilis. It takes class 5 to 10 minutes. So that's the duration here. Okay, it takes us 5 to 10 minutes. Okay, so tandaan po natin, it's the best way to what? Best way to see the bones. Okay, it's your CT scan. Okay, and also, class, we need to ensure these things here. What are your nursing considerations? Nursing considerations for patients who are about to be given, kapatid, DICE. Okay, This is for your contrast, okay? For your contrast dyes. Why? Okay, we need to check the renal function of the patient. Okay, dapat maganda po ang renal function ng pasyente natin. Why? Because magbibigay tayo ng dyes. Okay? So, what are we going to instruct to the patient? Increase the fluid intake. Okay? Post-contrast. Okay? Tandaan po natin yan. Post-contrast dye. Okay, we increase the fluid intake ng pasyente po natin. Okay? Monitor urine output closely after CT scan. Monitor UO. Okay? Urine output post CT scan. Okay? CT scan. And also class, we need to give a highlight on this special medication class. Hold. What do we need to hold? Hold metformin 24 hours prior and up to 48 hours after. Okay? Hold what medication class? Metformin. Okay? 24 hours. Okay? 24 hours before. Okay? Before and 48 hours. Up to 48 hours, no? After. So, tandaan po natin yan. Metformin, big word for your CT scan. Okay. So, let's proceed, kapatid. Now, we have your ultrasound. Okay, kapatid, kapag sinabi natin ultrasound, it uses your what? It uses your sound waves. Okay, it uses your sound waves, kapatid, to produce an image. To produce an image. Okay, it uses your sound waves to produce an image. Okay, so ano ba usually ang examples class ng mga organs na inu-ultrasound natin? Okay, so we have your bladder. Okay, number 1, bladder. Okay, bladder. Okay, your uterus. Okay, that's being done in your, in your OB cases. Kidneys. That's why we have your QB. Okay, kidneys. And also, kapatid, you have your number 4. You have your abdomen. Okay, you have your abdomen. Number 5, okay, we have your ovaries. Ovaries and your, of course, your testes. Okay. Number 6, kapatid, we have your vasculature. So, these are the sites or the organs, kapatid, usually, no, na that's under your ultrasound. Okay, so we need to take note that this is also a non-invasive procedure. And okay, so tandaan po natin, kapag we are looking at your GI, kapag digestive system, big word po dito, nursing consideration, if GI po ang i-ultrasound natin, no food, tandaan po natin, no food or liquid. Okay? No food or liquid. Okay? Kapag bladder naman po, if bladder, okay? Okay, or if we're scanning for pelvis, okay? Pelvis or for fetus, okay? Just like in your OB cases class, okay? Dapat full bladder. Tandaan po natin yan. Okay? So, that's it, kapatid. Okay, that's it for your ultrasound. Now, let's proceed to your lab values. So, lab values naman, kapatid. So, ang pinakamahalaga dito is we know your normal values. Okay, you get to be familiar with your normal values, or as much as possible, you memorize them. And what you need also to know is to to report your critical lab values. Okay, your critical lab values, you need to report them. Okay, so you need to know when to report. Kasi, kapatid, kapag hindi natin alam, ang mangyayari is that ganun lang. We'll just be very, very, we call this nonchalant. Yan. Okay? So, the most important thing here, okay, is that we understand. Okay? We understand, kapatid. We understand, okay, what the lab results indicate. Okay? What the lab results indicate. Tandaan po natin ito. Okay. So, ayan. Now, let's have your specimen collection, kapatid. Kapag sinabi natin specimen collection, ayan, we have your blood culture. Okay? Blood culture. Okay? Sa ating pong blood culture, kapatid, okay, what you need to, okay, gilid ko lang. We have your blood culture. Blood culture. Okay. Blood culture, kapatid. Kapag sinabi nating blood culture, what you need to do to know here is that we must take this, we must take the blood before, kapatid, before what? Before starting what? Antibiotics. Before starting antibiotics. Tandaan po natin iyan. So, of course, no, we must take the blood of the patient before starting antibiotics because it may already alter. Okay? So, tandaan po natin yan. So, tandaan po natin na it should be 10 ml per bottle. Makakuha po natin na blood po. Okay? So, kapag kapatid, not enough, okay, not enough po ang makuha natin. Okay, kapag hindi po enough ang makuha natin, kapatid, this would give us false negative results. Okay, kapag naman too much, okay, of course, this will also give us another false or inaccurate results. Okay, inaccurate results. Okay, so another thing, class, is your wound culture. Wound culture. Okay, wound culture. Okay, wound culture. Class, kapag sinabi nating wound culture, okay, what we need to do here is to take from, okay, clean tissue. Ayan, clean tissue. Okay, and also, kapatid, how do we gather this? How do we gather this? Okay, we gather, okay, the samples coming from the wound by what? By first rotating, rotate swab. Okay, rotate swab for at least how many seconds, kapatid? Okay, at least 5 seconds. Okay, tandaan po natin yan. Okay, 5 seconds. And tandaan po natin what technique do we use? We use po zigzag. We use zigzag method. Okay, we use zigzag method. That's for your wound culture. Okay, so now, how about, class, your, okay, how about your urine? Okay, kapag pagdating naman, class, sa inyong urine collection, kapatid, so remember that we should not, okay, it's a no-no, really. Big no in the board examination, big no in the NCLEX. Never ever, don't get out of indwelling catheter bag. Okay, you will not collect from the indwelling catheter bag. So, hindi pwede, kapatid, sa inyong catheter bag. And also, class, what we need to maintain? We need to maintain what? Okay, we maintain sterile technique here. Okay, maintain sterile technique if from catheter. Okay, so hindi pwede sa catheter bag, but pwede po sa catheter port. Tandaan po natin yan. Okay, if from catheter. Okay, catheter. Now, also, class, we need to maintain clean catch technique. Okay, we also use your clean catch technique here, lalo na, class, kapag sa ating pong sa routine urinalysis. Lastly, kapatid, let's discuss for your stool. Okay, what are your nursing considerations for your stool? Okay, for your stool, big thing here, you need to ensure that your specimen is not contaminated with water or urine. Okay, ensure, okay, that specimen, class, okay, specimen is not contaminated with water or urine. Okay, so tandaan po natin yan. That's the big thing there. Okay, so now let's discuss the sequence of laboratory or specimen collection. Okay? With central line. Ayan, central line kapatid. So this is what we need to follow here is of course we need to follow class very tedious. Okay, maintain now class your sterile technique. Okay? So first, what do you need to do? You gather everything. You gather supplies. Okay, you gather all supplies needed. Okay, number 2, perform hand hygiene. Perform hand hygiene. Perform hand hygiene, kapatid. And number 3, okay, scrub. Scrub what? Scrub the lumen, okay, with alcohol swab. Yan, alcohol swab. Yan. And also, kapatid, number 4, flush the what? Flush the central line. Okay, flush the central line. Okay, with 10 ml. Okay, normal saline. Okay, and after that, after you have flushed, draw 10 ml of blood and discard. Okay, number 5. Okay, draw what? Draw 10 ml. Okay, of blood and blood and discard. Okay, discard it here, right here. And also, kapatid, draw another 10. Okay, draw another 10 ml of blood, class. Okay, and what you're gonna do with this time, and put into tubes for labs, and put into tubes. Okay, in tubes for labs. That's it, kapatid. Okay, and next, number 7, class. Okay, flush. We need to have this one flushed with 10 to 20 ml. Okay, 10 to 20 ml of normal saline. Okay, and number 8, class, label tubes. Okay, label tubes now. Okay, with the proper, ano yung ilalagay natin? Okay, the name and date of birth, class, and also class, time collected and sent to lab. Okay, time collected and you send. Okay, collected and send to lab. Okay, so ayan. And number 9, of course, lastly, document. Okay, document collection. Okay.